Unit 11. Safety and First Aid. What is first aid? Accidents may cause pain, injury, and even lead to death. In such times, help is needed very urgently. First aid is nothing but to help a person suffering due to the accident or illness until the doctor's service is available. Accidents are usually caused by the carelessness of the people. In this lesson, let us learn about the various ways to deal with persons who have met with accidents or those who are not well. Severe wounds that bleed profusely. When the accidents occur, there are wounds which bleed profusely. One should follow the following steps when it bleeds continuously. First aid articles. 1. Wounds, either major or minor, should not be neglected. 2. Germs enter through the wound and cut, thereby causing infection. 3. Before giving first aid, we should thoroughly wash our hands because the germs in our hands may infect the wounds. 4. Clean the skin of the affected wound with small pads of cotton which are soaked in antiseptics such as Dettol or others. With the soaked cotton, remove all the dirt from the wound. If the wound is small, which is cut, clean the wound with running water. 5. Wound should be covered with a clean, dry cotton cloth to stop bleeding. In case cotton cloth not available, use handkerchief or clean cloth. 6. Apply a thick cotton pad or sterilite gauze firmly on the wound and press it with your finger or thumb. 7. Put a bandage and be sure that the band-aid is not very tight. 6. To stop the profuse bleeding, tourniquet, which is a tight band that is twisted above the wound, should be applied. 9. Keeping the patient's wound higher than the rest of the body. 10. If the skin is cut by a rusted or dirty object, there is possibility of getting infected by the dangerous diseases called tetanus. See the physician and get an anti-tetanus injection. Bleeding from nose. This is most commonly found in children. This occurs when the walls of the blood vessels in the nasal passage get ruptured. The following steps should be followed to a patient who is suffering from the bleeding of nose. 1. The patient should be allowed to sit back with the head slightly tilted. 2. The nose's bleeding side should be firmly pressed. 3. Wet cloth or an ice pack should be applied on the nose and head of the patient. 4. The patient should be made to breathe through his mouth. 5. The patient should not be allowed to blow his nose at that moment. Bleeding from nose. Sprains. Sprains are occurred when the tissues of the joint get torn. It may cause swelling or discoloration of the skin. This is very painful. In such cases, apply some cold ice cubes or cold pack at the joint that is injured until the swelling gets disappeared. Fractures. When there is a crack or break in the bone, we call it as a fracture. In case of fracture, 1. We should keep the patient at calm and comfortable place and call the doctor immediately. 2. If the bone is not fractured, apply the ice cubes at the injured part until the swelling disappears. 3. As far as possible, do not move the patient. 4. If the patient needs to be moved, either tie a splint as a support to the broken bone to prevent the unnecessary movement or use a stretcher. The easily available articles like sheets of newspaper, magazines, cardboard, pillow can act as a splint. This prevents the dislocation of the broken bone. 5. If the bone of the arm is broken, use a sling that is made of a triangular piece of cloth. 6. Either take the patient safely or call the doctor to the place where the victim is kept. 7. Finally, an X-ray of the fractured part should be taken. Doctor treating fracture. Burns. Burns are got from hot objects and also from chemicals like acids. Burns may be minor ones or severe ones. However, the burns are very painful. Causes. Burns may be caused due to touching of the boiling pans, kettles, etc. Nylon clothes can catch fire easily. Children and elders should be careful during Diwali. Matchsticks should be completely put off. Short circuit in wiring may cause major accidents. Minor burns. Minor burns are very painful but can be treated at home. For such injuries, we should 1. Apply cold water or ice cubes on the burnt part as cooling gives relief from the pain of the burns. 2. An antiseptic cream should be applied. 3. The paste of water and baking soda should be applied for little relief. Severe burns. In the case of severe burns, blisters are formed. 1. When such blisters are formed, do not try to prick them, as a broken blister is a kind of open wound. It can get affected. 2. Clean cloth or a sterile gauze should be placed on the burnt part to protect it from the air, which contains germs and dust particles. 3. If the victim lays unconscious state, never give any liquid to him, but if he is in shock, give him a sip of warm liquid. 4. Dip a clean and sterilized piece of cloth in a water and baking soda solution to use it as a compress. 5. Such severe burns should be treated only by a doctor. Chemical burns. Sometimes there may be chemical burns. In such situations, the following steps need to be taken. 1. The cloth that is affected should be removed. Use plenty of water and wash off the chemical affected area, which reduces the injury extent. 2. A clean cloth should be placed over the burned area. 3. If the burns are very severe, rush the victim to the physician. Steps to be taken immediately after a fire accident occurs. If there is a fire accident, we should 1. First, call the fire brigade immediately. 2. If it is caused by an electric short circuit, the main should be switched off immediately. 3. If fire catches a person's cloth, the person A. should not be allowed to run inside as it increases the flames. B. The victim should be made to roll on the ground. C. Also cover him with a thick blanket as it stops off the air and extinguishes the fire. 4. If the fire is caused by wrong wiring, then A. Switch off the main first. B. Don't throw water on it. Instead, throw mud or sand as it extinguishes fire easily. C. Do not throw water on fire caused by petrol or kerosene, as water increases the flames high up. To put out fire, throw sand or mud on it. Animal bite. The steps to be taken for animal bite are 1. Wash the wound immediately with water and soap, thereby removing the germs as they might cause rabies, which may be present in the saliva of those animals. Dogs, wolves, bats, and cats are the animals which carry the viruses of the rabies. 2. To prevent the infection, apply an antiseptic cream. 3. With a sterile gauze, bandage the wound. 4. Finally, take the victim to the doctor immediately. Snake bite. The 4 main common poisonous snakes are the krait, the cobra, the viper, and the sea snake. The 2 sharp fangs of a poisonous snake inject poison, causing a lot of pain and swelling. Treatment must be given immediately. Otherwise, the poison even kills the victim. 1. First, tourniquet should be applied above the bite to prevent the flow of blood to the heart. The tight band helps to slow down the spread of poison. 2. Then hurry the patient to the doctor. It is usually better to take precautions when you walk among the areas where snakes are all around. High boots are to be worn to protect your feet. Poisoning. To prevent poisoning, we should always remember to 1. Keep the medicine away from the reach of little children. 2. Before using any bottle, read the label very carefully. 3. All the vegetables and fruits should be washed well before eating because the farmers might have sprayed some harmful pesticides and insecticides. 4. Poisonous substances should not be transferred to containers which are not labeled. 5. Medicines should not be given in dark. 6. If there is any chance of taking any poison, try to make the victim vomit. 7. Then rush the victim to the doctor. activity. To do it, we need stiff paper, scissors, water, spirit lamp, and a matchbox. Take the stiff paper and make a shallow tray and pour some water in it. Hold the tray over the spirit lamp's flame. Observe what happens and write down the inferences. Let's revise the important points. 1. First aid is nothing but to help a person suffering due to an accident or illness until the doctor's service is available. 2. Accidents are usually caused by the carelessness of the people. 3. Some of the major first aids for the people who are suffering from wounds are: A. Wash your hands thoroughly before attending to first aid. B. Clean the skin of the affected wound. C. Cover the wound with a dry, clean cloth. 4. Bleeding from nose is caused when the walls of the blood vessels in the nasal passage get ruptured. 5. Sprains are occurred when the tissues of the joints are torn. 6. When there is a crack or break in the bone, it is called a fracture. The first aids to be carried on are: A. Do not move the patient. B. Ice cubes are kept on the swollen part until the swelling disappears. 7. Keep the medicine away from the reach of little children. Do these. 1. Answer the following questions. Conceptual understanding. 1. Define first aid. Answer. First aid is nothing but to help a person suffering due to the accident or illness until the doctor's service is available. 2. Write any 2 safety aids for those who are wounded. Answer. 1. Clean the skin of the affected wound with small pads of cotton which are soaked in antiseptics such as Dettol or others. 2. Wound should be covered with a clean, dry cotton cloth to stop bleeding. 3. What are the 2 important precautions to be taken for a boy whose nose is bleeding? Answer. 1. The patient should be allowed to sit back with head slightly tilted. 2. Wet cloth or an ice pack should be applied on the nose and head of the patient. 4. What is a fracture? Answer. When there is a crack or break in the bone, we call it as a fracture. 5. Name the 3 types of burns. Answer. The 3 types of burns are minor burns, severe burns, and chemical burns. 6. Whom should you call first when a fire accident occurs? Answer. If there is a fire accident, we should first call the fire brigade immediately. 7. If the fire accident occurs due to wrong wiring, what are the necessary steps to be taken? Answer. If the fire is caused by wrong wiring, then A. Switch off the main first. B. Don't throw water on it. Instead, throw mud or sand as it extinguishes fire easily. 8. Why should you wash off the wound when an animal bites you? Answer. Wash the wound immediately with water and soap, thereby removing the germs as they might cause rabies, which may be present in the saliva of that animal. 9. What is a tourniquet? Why is it used during snake bites? Answer. Tourniquet is a tight band that is twisted above the wound to stop the profuse bleeding. It should be applied during snake bite above the bite to prevent the flow of blood to the heart. This tight band helps to slow down the spread of poison. 2. Fill in the blanks. Conceptual understanding. Three. Write T for true or F for false statements. Conceptual understanding. 4. Do you know? Many of the common things we use in our home are poisonous. They are nail polish, paints, detergents, some medicines, and naphthalene balls. Do you know the first surgeon in India? He was Sushruta. He lived in 6th century BC. He performed some eye operations as well as removed stones from human body. He conducted these operations by giving them wine to keep their sense numb, thereby resulting no pain. This famous work is Sushruta Samhita. 5. Project work. 1. Ask the students to collect a first aid box and place it in their class cupboard so that they can use it whenever necessary. 2. Ask the students to prepare a chart which tells them about road signals.